call on the third speaker, Mr. Mohan H L, who is working with the Karnataka Health Promotion Trust, and he will be talking about the next level, which is the village health and sanitation committees. Maybe that may shed some light on why people are not coming to the institutions for deliveries and not changing their practices. Yes.
Yeah, respected Chair and also my co-panelist. I think from yesterday we are discussing a lot about the community, communitization, community involvement, decentralization, and also now I think he highlighted a lot of cultural practices and other related community issues. I think this is one exercise as part of NRHM which is done in Karnataka, that capacity building of VHSC members. Though it is established almost 3-4 years back, but last 2 years back, somebody like Mohan Gopal thought of introducing in a big way of building the capacity of all VHSC members. Specifically to understand their roles and responsibility, and also how the community can monitor the health issues within the village, and also they can plan the village health issues, so on. So when we started working in 2 of the districts, Bagalkot and Koppal, I think that's one of the strong belief what we had in our organization, that decentralization of the things can change. Unfortunately, in the health department, I think something which is not thought of last from 60 years is that community involvement, because that is such an issue that always people are very scared about talking about health and other medical issues. So this is some exercise very, very challenging. So we are very much in the opinion that something which can be done at the lowest level can be done. What can be done at the lowest level, the best to be done at the lowest level. So we followed some kind of a principle. What? ARS, VHSC at different level, district level and also PHC level, sub-center level and the village level. Absolutely there was no clarity among what each of the committees need to be done. So there are some guidelines, but we sat together, Dr. Sudarshan was there, the entire Janarogya team sat together and tried to work out what exactly the role and functions of each of the committees at different level. So we also ensured about the people participation. That is one of the important component when we are talking about community involvement in the entire issues. And we also observed that accountability usually with always the funder, the people are more accountable to the funder. So the 10,000 rupees untied fund is given from health department. So the entire VHSC is accountable to them rather than the community which they are working for. So these are the few principles we kept in mind when we have started. And also the framework of empowerment is the something base for to work with this group. That is power within, because we talk about, because we are seen in the education sector. Yesterday Health Secretary was mentioning the whatever started in village education committee, now it is school development and management committee. It took years together to evolve a lot of results. So this is the first time what is introduced in the health sector. So we thought that something like empowering the community at the lowest level will yield some kind of a result. So we use the framework of power within and power with others and power over resources, which will help us to bring the people together and also reach the unreached community, so on. So we started with the participation because the whole the committee is reformed, whatever the existing committee at that point of a time. So we can see in the Bagalkot and Koppal that almost all the committees, either it is formed through Gram Sabha or Ward Sabha and Samanya Sabha. Before that, it was done in the paper by Ashas and Anganawadi workers. So we wanted to take back to people where the community can identify the community members. And that is the one exercise which we did. And also hand-holding meetings, that is one of the part of this whole intervention. And 3-day formal training for VHSC members, and also Kalajata and Jansamvada. So when we started this, we also thought of doing some baseline. This baseline is done in almost all the villages of both Koppal and Bagalkot. That is 1,190 VHSCs. So we divided into functionary and non-functionary. Functionary is somebody who receives one or the other way, direct or indirect incentives. That is ASHA, the Panchayat president, and also ANMs, so on. Anganwadi worker, and the non-functionaries are the representative of SHGs, the SC/ST community, and the local group. This is how we divided. We try to collect baseline as well as endline from both the group. And we also did the FGDs in almost all the villages, try to understand the vulnerable group issues, because that is our priority to reach the unreached community. So, the end line showed there is a marginal increase in the VHC membership. It is gone up more than 50%. Somewhere it is 14,000 to 25,000, because almost it shows that almost it is managed by the functionaries. The involvement of non-functionaries, somewhat it is nil. And this is the increase in the non-functionaries, because as per the guideline, it clearly mentions that 15 members in the community need to be a non-functionaries. They are represented by different sect of the community. They are from the SC women, and also the 50% need to be women. So this is the guideline speaks, but in the reality, it is dominated by the functionaries. So, so the guideline talks about the involvement of the women. So they had a very easy way to reach the women, that identified some women from the self-help group. Instead of going to the specific community, like SC community, tribal community, they just taken the women from the SHGs and they are put as a members in the VHSC. So when we started reforming the VHSCs, then we clearly known that who are the people need to be represented by the different sect of the group. So then marginally the SHG members also decreased in representing the VHSC. Here again it is, if you take the minimum member non-functionaries around 15 to be there in the VHSC, but whereas in the baseline it showed that it is something below 5 as well as between 6 to 10, whereas the 11 to 15 where non-functionaries are increased tremendously after the intervention. And again, it is how earlier it was more on 6 to, because 8 members, minimum 8 members has to be women in the VHSC, but it's almost less in the previous baseline, whereas in the end line it showed almost 74% increase in women's participation overall. And the meetings, which is almost 22% of the VHSC did not have any meeting last 3 years, because baseline is almost for the, before that almost VHSC is constituted for 3 years. But in the end line, it shows almost all the VHSCs had one or the other meeting. And again, the circulating, because as per the norms, they have to circulate the meeting notice, but absolutely 50% of the VHCs only circulated the meeting minutes, where it is increased somewhere 96%. Again, those who conducted a VHSC meeting, the proportion recording minutes, though, because usually that sometime meeting may not happen, but people will record sitting at home or some, because they have to draw some amount from the untied fund. That was the usual practice, but that was changed a little bit after the intervention due to handholding process and involvement of the community itself. And if you see the topics discussed in the last VHSC meeting, it is somewhere, it is more concentrated sanitation, drainage, and the drinking water issue, which is somewhere moved into more maternal health and the death of the newborn, and also on the utilization of untied fund, which is given by the health department. Annual health plan, though it is one of the functions of VHSC, is absolutely, there is no, because that kind of a capacity building has not done earlier. So there is a big increase in the developing the annual action plan within the VHSC, which is submitted later to Panchayat. And Jansamvada, this is the one exercise, but absolutely this is a, we can't see as an achievement because which is not done earlier. It was not in a practice in the health department because it's a part of this exercise, whereas people are participated in Jansamvada where the PHC doctor, even at the district level, they are part of this entire process. And again, the health camps, this is not very encouraging result, whereas only 6% of the VHC has organized the health camps against to 3%. And immunization camp is also not encouraging. It is a 9% against to 2%, where community is taken initiative to organize the immunization camps. And birth and death register, this is some exercise which we introduced in these two districts. I think almost 77% of the VHSC started registering through ASHA and Anganwadi worker. They ensured that the registers are maintained. And events, it was, they used to mobilize communities for the different events, but earlier it was something like more on organizing nutrition camps and also blood donation, so on. But we can see that still it is again a drainage cleaning, water tank cleaning, and support for safe delivery. I think this is something which we took as a part of the core component of this training. Only that part is increased, and still the drainage cleaning and water tank cleaning continues to be the focal point for the VHSC members because that is the local issues there. And when it comes to the spending, the discussion in the meeting or the fund spent for the different categories, still it is on the either to purchase some equipment for the Anganwadis or some paying the phone bills for the ASHA worker, that still it is there. Though we try to encourage to spend a lot of money, this money for to support the nutrition, support to the transportation for the pregnant women, but still we are not able to change because we call untied fund, but it is not really an untied fund because I'll come later that how this is different circulars are issued from the top. I'll take 1 minute. Non-functionaries ever received training. This is something, yes, they are not received any training earlier. Because of this intervention, I told earlier, the government of Karnataka thought that to divert this entire capacity building to for the VHSC members, almost, we also had lot of issues on MNCH and other things. Ever attended the meeting, you can see that 48% versus 97% where non-functionaries started attending, especially SC/ST women. I have under data, I'm not submitting now. And just to sum up, here the non-functionary involvement in VHSC has increased significantly. Representation of marginalized communities, both men and women, is increased. VHSC involvement in activities like Kalajata, Jansamvada increased significantly. VHSC meetings on the rise with the intervention. I think this is something which we can see in this entire intervention. The challenges, especially sustainability of handholding and also the department. The top level department officials are very encouraging, but at the middle level and the lower level, it is little bit because they see that community involvement is actually disturbing their own way of functioning. So we had to get their support. Untied fund, but the entire VHSC and the team who are implementing struggled in just avoiding the circulars from the government. Each time we used to receive a circular at the field level, either use this untied fund for buying saris for ASHAs, because they want a different, similar color of saris, either pay their phone bills, either buy something. Somebody like Jilla Panchayat, sometimes our government officials, they are not helpless. Bagalkot, Jilla Panchayat Adhyaksha put a pressure on the health functionaries at the district level, so we have to buy 0B for Anganwadi. And later I came to know that is the third 0B they are buying for the water purification, because there is some kind. So he didn't get, then he told, no, we have to take a permission from Bangalore. Then he calls up to Bangalore. Then we tell, no, you can't buy anything because this is VHSC money, they have to make use of. So there is a lot of pressure, because this whole untied, both at the ARS level, both at the VHC level, need to be looked into. And also link with the Panchayat. Somewhere still it is functioning out of Panchayat parallelly from the health department, how to link it that. VHC through the responsibilities pursued in well functions viewed a power structure or as a responsibility. I think that is something still a challenge. Sometimes they'll try to boss over Ashas, which we try to do now. We are doing that exercise now. That is more a supportive system. So there are some solutions which I listed. I may not take time on that. Thank you very much for patiently listening. Thank you.